My name is Gordon Joyce. I'm 74 years old and I've been in Dubai for more than 3 decades. 4 years ago, I was diagnosed with small cell lung carcinoma, which came as a bit of a shock. The story behind that was a chest infection in the summer of 2019, which I thought was recurring in the winter of 2019 and the spring of 2020. And I went to my local Mediclinic family clinic in the Meadows. The doctor there wasn't happy with the sound in my chest or my self-diagnosis because he didn't believe I'd been studying medicine long enough. So I was referred to Mediclinic Parkview Hospital for further tests. The pulmonologist there was very unhappy with the results and insisted on a PET CT and MRI scans. The scans revealed that I had lesions on my lungs which looked as if it was cancerous. This came as a big shock at my age, and the next step was to come to Mediclinic City Hospital for biopsies. After the samples were obtained, they were sent to the US for genotyping, and the result of the genotype was the confirmation of a diagnosis of small cell lung carcinoma. The night of the diagnosis, 19th of March 2020, I was visited by Dr. Shaheenah, and she told me in no uncertain terms what I was going to do.
I first met Gordon in March of 2020 at the peak of COVID, when everything had gone crazy. I still remember going to the surgical floor, having been called to see Gordon. He'd just been diagnosed with small cell lung cancer at an advanced stage. I had to go into his room and explain to him that patients with advanced stage small cell lung cancer, the prognostic outcome is not very good. And the first thing I noticed about Gordon was that nothing was going to bring him down. He wanted to fight this disease, and that's exactly what he did. He became part of the Mediclinic family that we are over here, and we treated him in a personalized fashion as we do all our patients. I sat with him, we discussed various therapeutic options, and we settled on a treatment plan that involved giving him chemotherapy every 3 weeks together with immunotherapy every 3 weeks. At the end of 3 cycles of chemotherapy, we did his scans and he had a brilliant response to therapy. And at the end of 6 cycles of chemotherapy, we repeated his scans and he'd gone into complete remission. And over the last 4 years, he's been on immunotherapy every 3 weeks, and he continues to be in remission. His last scans were done literally a couple of months ago, and he has no evidence of disease thus far. He spends half his time in Dubai and half in Canada. And every year at his graduation, he brings me a little stuffed toy just to be aware of the fact that he is alive and he's doing very well. And he teaches me an important lesson. No matter what we do and what we say, it's the patient that's the most important person who can beat this disease and who can be that person that is the little miracle that we are looking for every single day. So thank you, Gordon, for teaching me that important lesson and being part of not only my family, being my friend, and being a part of the growing Mediclinic family that we have here.